Hello everyone, this is Neha, third year medical student from Bangalore. So last month I was posted in ophthalmology, and in today's video I'm going to share my experience of ophthalmology department, which was my first postings in third year. Postings are one of the most interesting and most important part in our medical colleges. We get to visit the hospital, see the patients, talk to patients, take their history, ask leading questions and try to diagnose the case. It's totally the feeling of a detective. Most of the times we may not be correct, but at the end we always end up learning something new. We learn regarding various signs and symptoms of a disease, how the patient presents. Not only that, we also learn various soft skills like asking questions to a patient in pain, empathy and confidentiality, to name a few. They say eyes do not see what the mind does not know. So before showing us the cases or the patients, they taught us about most common diseases of the eye, most common things we encounter in our day-to-day life, and how to use the Snellen's chart, how the glasses are prescribed, various instruments used in the OPD like ophthalmoscope, gonioscope, etc. Most of us take our eyes for granted, but we can't even imagine our life without our eyes. Just close your eyes for a moment and imagine your life in darkness. It's not possible, it's very difficult, and that's one of the most important things that I learned in this 1 month of ophthalmology postings. I learned how our daily activities are damaging the eyes, like it may be excessive UV exposure or excessive exposure to dust, pollution, or one of the most important damaging factors to our eyes currently is excessive screen time. Thanks to COVID and lockdown, most of the schools and colleges shifted to online classes, adding to the excessive screen time and damaging our eyes even more. Most of us unknowingly have experienced the computer vision syndrome, which is caused by excessive screen time. Some of its symptoms may include redness, itching, burning of eyes, watering in the eyes. So according to a study conducted by gathering data from students, the screen time increased to at least more than 6 hours per day, and 13.8% of the students' prescription glasses changed due to increase in their power, and 3.8% students started wearing glasses additionally. So this may seem very small numbers, but these are just the recorded numbers. The actual numbers may vary highly. Technology has become an inevitable part of our daily life. So we can't avoid totally the screens, but we can at least protect our eyes to some extent. So I'm going to share some tips that can help you reduce the amount of damage to your eyes. First thing is, turn on the blue light filter or the eye protection mode in your gadgets like phones, laptops and tablets. Second thing is, wear blue light blocking glasses that can at least reduce the amount of blue light to an extent. Third thing is, follow the 20-20-20 rule, which says that after every 20 minutes of your screen time, take a 20-second break and look at an object that is 20 feet far away. So this can give this relaxes your eyes, and it gets rid of the constant pressure of your eyes to focus on an object that is very close to you. Coming back to the postings, we saw many cases of cataract, various types of cataract and the surgeries done for its correction. It was indeed a wonderful learning experience to see our professors perform cataract surgery with such precision, and it was indeed a very wonderful experience to see the patient, how the patient got hope after the surgery that they could be able to see again. That happiness on their face was worth watching. We also saw some cases of orbital mucormycosis, which is infamously known as the black fungus. Who doesn't know about it? The fact that a small organism such as a mold can create such severe complications that can result in removal of the eyeball, it's indeed terrifying but true. We also saw how certain occupations like goldsmith, welding and all, they commonly undergo small trauma to the eyes because of that metal particles and how they neglect it, and at a later stage they presented with pterygium, a complication where your vision can be obstructed and it can lead to some complications as well. It was an enriching experience, and on this occasion I would like to remember one of Helen Keller's sayings: of all the senses, sight must be the most delightful. And it's indeed true. Let's all take more care of eyes and appreciate the wonderful sense of sight that we are gifted with. I hope you found this video interesting. If you did, don't forget to like, comment, subscribe and share it with anyone who you think might find this video helpful. See you in my next video. Take care.